So the most common reason for owners to bring their pets to a dermatologist are allergies. And allergies, unfortunately, they disrupt the epidermal barrier and predispose our pets to develop skin and ear infections, and those are one of the most common complaints we see them for, with staphylococcus infections being the most common ones, affecting both the external ear canal and the cause for superficial pyodermas. If you are presented with a case clinically consistent with superficial pyoderma, it will be extremely important to perform skin cytology so we can identify the presence of bacteria and then guide our treatment. The same with ear infections. So if we perform cytology, we need to identify that they actually do have bacterial infections to select our treatment appropriately. That will be the first step. Do we have a bacterial infection? Then we can target our treatment a little bit better and select our products so we are more effective when treating these infections. For most cases, actually most cases of superficial pyoderma and otitis externa can be managed with topical therapy as a sole therapy. In some cases, we combine topical therapy with systemic therapy if necessary, but most cases can be managed with topical therapy by itself, which is an advantage because it will minimize the use of antimicrobials, it will minimize the side effects, in many cases it will minimize the cost for the client. So it does have many advantages, and we should utilize them more often. For example, for management of superficial pyoderma, we can use antiseptic therapy in different forms, and that will be important to identify if it's a localized infection versus a generalized infection. We can use different delivery forms for these antimicrobials. So we can use, for example, medicated baths, we can use foams, sprays, medicated wipes, and that will increase client compliance. We can be successful with topical therapy as a sole therapy for management of most cases of superficial pyoderma. For treatment of otitis externa, topical therapy is very effective. We don't need systemic therapy if we're treating otitis externa only. If there is otitis media or interna, then systemic therapy is indicated. But for otitis externa, we can treat those cases just with topical therapy very successfully. If we need to add topical antibiotics to your treatment protocol, products that we often use include mupirocin, which are very effective against staphylococcus infections, aminoglycoside like gentamicin or amikacin can also be used topically, clindamycin can be used topically, and we can also use non-antibiotics like honey, which is a very good antimicrobial. If we have new lesions developing 2 weeks or after 2 weeks of starting topical antimicrobial therapy, you may need to add systemic therapy to the treatment protocol. How do we select our systemic therapy if we feel that is necessary? Empirically, honestly, the only antibiotic that we use empirically are first-generation cephalosporins. If they are not responding to first-generation cephalosporins, if they have had multiple treatments not responsive to systemic antimicrobial therapy, if they have received antimicrobial therapy within the last 6 months, if they have history of methicillin-resistant or multi-drug-resistant infections, if they continue developing new lesions 2 weeks or more after initiating antimicrobial therapy, or if you find Rothschild bacteria in your skin cytology, then culture will be indicated to guide your treatment. Unfortunately, we are seeing not only methicillin-resistant but multi-drug-resistant infections, including third-tier antibiotics, and with many of these cases having no systemic antimicrobial option for treatment. help keep antibiotic use useful for both animals and humans.